I'm Antoni Chan reporting here from ACR 25 in Chicago, and today I want to share with you a very interesting poster, an abstract which is number 0849, which looks at the risk of cardiovascular deaths and mortality with the use of GLP-1 receptor agonists in psoriatic arthritis. This was a retrospective analysis looking at a significant number of patients with psoriatic arthritis who also were started on GLP-1 receptor agonists for treatment of their comorbidity, namely type 2 diabetes. We know that these GLP-1 receptor agonists, drugs such as semaglutide and liraglutide, have been known to not only reduce weight, but also to have a protective effect in terms of cardiovascular and renal protection. So the purpose of this study was to see whether it could also translate to reducing cardiovascular risk in patients with psoriatic arthritis. As we know, our patients with psoriatic arthritis have an increased risk of cardiovascular deaths and mortality. So this was a design where they used the Trinetics data, where they had 4,000 over patients with PsA who were on GLP-1 receptor agonists, and around 86,000 patients who were not on GLP-1 receptor agonists. They matched the patient using a 1-to-1 propensity score matching on demographics, diagnosis, and medications. And the outcome were major cardiovascular events, or MACE, and also all-cause mortality. After matching, the results were that the GLP-1 receptor agonists, patients who were on this treatment had lower risk of MACE and also had lower risk of overall mortality compared to those who were not on the treatment. The demographics showed that those who were on GLP-1 receptor agonists, they tended to be slightly older, and also there were more females who were on this treatment compared to those who were not on the GLP-1 agonists. The population was predominantly white patients in both groups. The limitations are obviously based on the study was the coding of these patients, that they obviously were based on a database from Trinetics, so there could be potential coding errors in this, and this was highlighted in the presentation today. I think this is an interesting presentation because we have been looking into how GLP-1 receptor agonists may offer protective cardiovascular and survival benefits in our patients with psoriatic arthritis, especially those patients who have the concurrent comorbidities, namely obesity and also type 2 diabetes. What this study shows today is that there's potentially a potential role for not only management of inflammation in psoriatic arthritis, but also management of the metabolic phenomena that also happens together in these patients with psoriatic arthritis. So I think further research certainly would be important, firstly to understand the mechanisms behind the metabolic and also inflammatory and vascular connection between these mechanisms, and secondly to study how this long-term comorbidity can be reduced by the use of GLP-1 receptor agonists. I'm Antoni Chan reporting here for Room Now in ACR 25 in Chicago.